This is Radio Health Journal. I'm Nancy Benson. This week, Humanizing the ICU.
I now really value that component of my being at the bedside with these people more than I do the procedures, the beeps, and the buzzers.
Administering hope in the ICU when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The Salvation Army has definitely seen that drop off. A lot of people approach the kettle and say, I don't have any cash with me.
The digital currency effect on low-income populations. Then,
how many people focus on getting the holiday cards done, making the cookies, buying the right gift? We have historically done this as a culture and society, and I think we've been off base from the get-go.
Focusing on what really matters this holiday season. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
All new doctors take the Hippocratic Oath to help their patients and never harm them. But Dr. Wes Ely admits that early in his career as an intensive care specialist, he forgot about that and focused mainly on medical procedures. Ely says he dehumanized the very people he had vowed to care for, sometimes causing more pain and trauma than the original illness.
Earlier in my life, before I was a gray-haired ICU doctor, I was enamored with and excited about the skill set I had obtained in training to place central lines and put people on life support and manage ventilators and that sort of thing. And I think that I had a distance between myself and the patient and tended to dehumanize them in my mind. Subconsciously, of course, it was a critical behavior pattern that did not lift up these people and provide really the support and love that they needed to completely heal, for holistic healing.
Today, Ely is professor of medicine and critical care at Vanderbilt University and associate director of the Critical Illness, Brain Dysfunction, and Survivorship Center, or CIBS. He writes about his change of heart and new approach to healing in his book, Every Deep Drawn Breath.
I now really value that component of my being at the bedside with these people more than I do the procedures, the beeps, and the buzzers. I completely cherish looking in their eyes, holding their hands, taking care of them when they're suffering, and being present with them, not feeling sorry for them, but being with them, and that's the big difference.
Ely wasn't unique in his focus on the beeps and buzzers. ICU doctors and nurses around the world depend on technology to care for their patients. But Ely believes they also rely too heavily on the practices of patient sedation and immobilization. These two methods have become standards of care because they are the easiest and quickest way to stabilize patients on life support. But Ely says prolonged sedation and immobilization often causes PTSD and post-intensive care syndrome, also known as PICS.
And this syndrome is one of acquired dementia, acquired PTSD and depression, and then physical disability. And we find that about 1/3 of people get new depression and about 1 in 5 get post-traumatic stress disorder. And they go on to have profound nightmares and inability to sleep, and their life is really dramatically changed.
10 years ago, Ely visited ICUs in 40 countries. He says sedation and immobilization were standard practices in all of them but one. Denmark was the exception. Ely returned home determined to change the way he practiced medicine. He spent the next decade creating an approach to care that he calls the Abcdef Bundle.
It's a bundle based on humanization and touch. And what we do is every day, we, just like a pilot would check a safety checklist prior to getting on an airplane and flying you across the country, we at every bedside run through this Abcdef bundle. We wake the patient up, we see how they are doing, make sure their pain is covered if they're in pain, and then we test them to see if they can come off the breathing machine. We test them for delirium. We get them out of the bed. We involve the family at their bedside, And those are essentially the steps: turning off the sedation, paying attention to who they are in the bed. If they're delirious, we run through a few steps to take care of their delirium and get their brain back on so they can speak to loved ones and engage with the people they value the most in life. And to me, it just gets me back to the human that I'm supposed to be caring for.
Ely's bundle approach, which she's taught in dozens of hospitals around the U.S., has improved survival rates for more than 20,000 patients, reducing their length of stay in the ICU and preventing readmission. But with the advent of COVID-19, Ely is appalled to see a backslide into the old ways and an increase in patient isolation. No families allowed by the bedside, patients dying alone. And worse, he sees doctors taking a judgmental attitude toward patients who choose to remain unvaccinated. Even Ely admits he wasn't immune to this stance.
When I was with them, I was allowing judgment to come in. My pride flared. And just to be quite honest, I don't think I was really showing these people respect. And I was making a lot of assumptions about where they were coming from. And that does not serve them well. And it also leaves me vulnerable to burnout. I really think that the antidote to the burnout, for me, I have found that to be this physical and mental connection with people, holding hands, kneeling at their bedside. Miss Smith, I will not leave you. I know you're scared. Our team will stay with you. Regardless of how, for example, they came to get COVID, whether they're vaxxed, unvaxxed, I just need to see this person as an entire human being and lift them up and show them dignity and respect.
Ely believes that COVID is a clarion call to get back to practices that work.
One of the things that I'm really counting on and advocating for is modifying these visitation policies. We know that PPE works now. We know this can work. And I'll turn around a question to you. I wonder how many people, and we'll never know the answer to this question, but I wonder how many people died for loneliness, lack of a loved one being there, and just losing hope, a lack of desire to keep going if you don't have a loved one there whispering in your ear, holding your hand, and helping you. So I do think that the once draconian no visitation policies we created at the beginning, partially out of fear and partially out of need for safety, they can be adjusted dramatically to allow much more involvement of families at the bedside, and should be. Each hospital is going to figure out how they can accomplish that.
And if family absolutely cannot be allowed into the ICU, Ely says at the very least, the patient must have an iPad or cell phone close by where family members can talk to their loved ones, even if the patient is unconscious.
Even if they're sedated and unconscious, I want that person's voice whispering in that person's ear, because we don't know what that person can understand and how that might be healing and give them hope even when they seem unconscious.
Ely hopes the patient stories in his book will inspire hospital administrators to change their ICU practices and visitation policies, even during the pandemic.
Last week, a patient of mine said she had lost hope. She had cancer. She was in the ICU. She was on a ventilator. And she said, okay, I'm going to die here. And then we got her out of the bed, walked her, and she saw her loved one, and she said, oh, my gosh, you didn't give up on me, so I must not be dying. In other words, the very act of just waking her up and getting her out of the bed meant to her that we thought there was a reason for her to keep living. And she said, that gave me the hope to keep going. And she's now out of the ICU, recovering, and about to leave the hospital.
You can read more inspiring stories of hope during these trying times in Wes Ely's book, Every Deep Drawn Breath, available now. You can learn more about all our guests by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Our production manager is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
With many opportunities to celebrate during fall and winter, preparing foods for all the festive occasions can be both a joy and a challenge. Selecting basic foods that can work in multiple ways, such as fresh grapes, can simplify things greatly. According to registered dietitian Courtney Romano, health advisor to the California Table Grape Commission.
Fresh grapes are beautiful. They taste great and are easy to keep around for everyday eating as well as special occasions. Keep some on hand for a healthy snack option. Arrange them in a pretty bowl for a classic and edible centerpiece, or in small clusters on a serving platter. Use them as a special ingredient. Heart-healthy grapes can be dipped in dark chocolate for a delightful dessert that is good for you too.
Heart-healthy grapes from California are in season from May through January. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which may help contribute to heart health. Visit grapesfromcalifornia.com for more information.
December 5 through 11 is National Influenza Vaccination Week. The American College of Physicians, a national organization of internists, advises adults to get an annual influenza vaccine. It's also the perfect time for adults to discuss with their internist other recommended vaccinations they might need. Dr. George M. Abraham is ACP's president.
As we continue to deal with the impact of COVID, we must not ignore the need for protection from influenza. Vaccinations protect us against more serious health issues that result in hospitalization, disability, or even death. They also help prevent the spread of disease, especially among those who are vulnerable to complications, such as the elderly and others with chronic conditions or weakened immune systems.
In addition to getting an annual influenza vaccine, ACP advises adults to ask their internist if they need vaccinations or boosters to protect against other preventable diseases like tetanus, diphtheria, whooping cough, pneumococcal pneumonia, meningitis, cervical and other cancers, hepatitis B, and shingles. Find out more at acponline.org/AI.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
In fact, you are increasing levels of beta amyloid. That is a hallmark of Alzheimer's disease, even after one night of sleep deprivation.
How not getting enough sleep is way worse for the body and mind than we ever suspected.
Then the race for a COVID-19 vaccine and why most of the big vaccine makers struck out.
Some of them had efforts that faltered. Some of them sort of were interested in building a COVID-19 vaccine, but really weren't.
All that and more on Radio Health Journal.